Hello, everybody. Thanks for joining. Just give us one moment. We're getting set up, making sure everyone's connected. So we'll give a few minutes for people to trickle in. All right, folks. Thanks for joining us. We'll be getting started here in a moment. We've got, my name is Will, the go-to-market lead for orthopedics here at Heidi Health. And I've brought along two kind of power users on the platform that have been using Heidi to help with their notes for a little while here. We've got Dr. David Klein and Dr. Matthew Zaborowicz, both of which will be sharing a bit about how they've used Heidi to transform their practice, save time, and some of the other benefits they've experienced. So, got a quick agenda. As I mentioned, both these gentlemen will be presenting, and then at the end, we'll talk a little bit about some of the newly released features that we've launched and what's upcoming for Heidi, and give some time for questions and answers. As I mentioned, being joined by David and Matthew. Dave is an orthopedic surgeon. I'll let him introduce himself when he speaks, but he's at Kennedy White down in Sarasota, Florida. And Matthew is a non-operative sports medicine physician based out of Michigan, at Ortho Michigan. So really happy to have both of them here with us. I can talk about Heidi all day, but I think it's a lot more powerful when you guys have a chance to hear from those who are actually on the platform, using it day to day and experiencing the benefits that Heidi can bring. So without further ado, I will step aside and let Matthew take it away. Dr. Whenever you need me to change slides, just let me know.
Sounds good. My name is Matt Zaborowicz. I work in Ortho Michigan, which is a private orthopedic clinic out in Flint. And I've been there for about 3 years. I've been using Heidi. I can't even tell you how long now. It's just been great. Probably at the very least like 6 months now, maybe a little longer now I think about it. But yeah, I'm going to talk about just kind of what I do day to day, and then how Heidi's been very, very helpful in terms of like making my work just more efficient. I think that's kind of the big thing, the big takeaway. So go ahead, Will. Next slide. So again, private orthopedic clinic. We've got 10 surgeons, so 3 total joints, 2 traumas, 2 uppers, 1 foot and ankle, 1 sport, 1 spine, and then myself as like the non-operative primary care sports medicine physician. We've got 5 PAs. Just me, myself personally, I see about anywhere from like 25 to 40 patients a day, like 4.5 days a week, pretty much is what I work right now. I also help out. We have an orthopedic like walk-in urgent care, so I see a lot of patients through there. I'd say almost like, yeah, I like half my patients, just right now too, because we're short on PAs, but I see a lot of orthopedic urgent care patients. And Heidi's been actually way more helpful for that than anything, to be honest. But I do a lot of ultrasound guided injections. Obviously, I coordinate with athletic trainers and take care of the athletes from that standpoint. So we do have like residency programs in the area, and obviously, some medical schools in the area as well. So I will frequently have like students and residents too, so that as I'm sure some of you guys know, that just kind of like drags down your efficiency in some ways. But yeah, that's kind of what I do. We have an older EMR. We're going to transition to Athena soon, but our old EMR is kind of like an old word-based EMR, which isn't integrated with Heidi, unfortunately. But I think that'll change in the next few months as we transition. So go ahead, Will, next slide. So before Heidi, I was mainly just using an old school dictaphone, and I would I'd see the patient, I'd kind of dictate start to finish, like HPI, HPI, I would dictate my imaging and my assessment and plan. I had templates built into the system, so I was doing a lot of the physical exam. I was trying to do the physical exam as I was coming out of the room, just so I wouldn't forget anything important on the exam. And then, if I didn't finish the notes or if I didn't finish the dictations, I'd have to come home and then you have to go through your charts and your paperwork, and you got to be jotting notes down in the room just to make sure you have enough from the HPI to actually like recall the whole encounter, make sure you have everything important in your dictation. So the thing that I was realizing was, my notes weren't quite as accurate as I wanted them to be. I would forget things about the encounter, and I was doing a lot more work at home, which was just kind of detrimental to my efficiency and my home life. So that's why myself, some of the PAs, a couple of docs were looking at some of these AI scribes as they were becoming more popular to see if that was going to be helpful for us in our day-to-days. So go ahead now. Go ahead, Will. So this is kind of like a picture of our old EMR. So you can see it's very similar to a word-based documentation system. So this was kind of my old template and how I would do it. I had built-in templates for each body part. And then go ahead, Will, if you go next slide. You can kind of see that I could fill in the chief complaint, and then I had a physical exam built in for my templates for each body part. So, as I was seeing patients, I at the very least would try and just try and jot down real quick, the physical exam findings, and then have enough information hopefully to kind of circle back when I had an extra few minutes to fully dictate the whole encounter. But I've just found that it was just very inefficient. So, go ahead, Will, next slide. So currently with what I do with Heidi, like my basic workflow, you definitely can pre-chart if you want to. I think some of the surgeons do the pre-charting a little more frequently, especially if they're like at home and they're reviewing imaging findings, or if they're reviewing post-surgical notes, if they're seeing like post-op patients. I don't do too much of that, to be honest with you. Usually what I'll do is as the charts come back to me, patients that are ready, I'll just go into before I go into the room, I'll look at their past notes, or I'll look at the notes that my medical assistant jots down, and I basically just give like 3, 4 quick sentences to kind of prompt Heidi in terms of like which way we're going to go. So, 15-year-old female here for follow-up for her right knee. She's been in physical therapy. I last saw her 6 weeks ago, and it sounds like she's doing well. And then I go in there. I just take my phone in with me. A lot of our patients already know that we use these AI scribes, but I try and remind them. And basically the phone just stays either in my pocket or on the counter throughout the encounter. I haven't had any issues with it, like picking up information no matter where I leave my phone. And then the other advantage too is since the patients know what I'm doing, as I'm doing my exam, it's very simple for me to talk through the exam out loud. And again, once you see my templates, you'll see like Heidi does a pretty good job of sorting that information out and putting it into my exam. So it makes it a lot easier. So I could just say, okay, active range of motion, 0 to 90 degrees on the knee. She's got tenderness palpation along the medial joint line, positive McMurray's, laxity with Lockman's. And then I can say stable varus valgus stress, rest of exam is normal, and it'll fill in the rest of my template, just kind of plug in those little pieces, and then away we go after that. I don't use a lot of this is just my personal preference. I don't use a lot of preset templates for my dictations for my imaging reads. You definitely could, but I just found that I use my imaging reads very, very importantly in terms of my mindset and of like for follow-ups especially. So I usually just say, formal, whether I do it, I'll open the images before I go in the room. And then whether I read them right away or whether I read them after I come out of the room, I just basically, and you'll see it in my template, but I basically say, formal X-ray read, 3 views of the knee, AP lateral sunrise shows this. And then I programmed Heidi to try and insert that verbatim just exactly as I'm dictating it. And that's just my workflow. That's what I like to do, just because for me, knowing what I was thinking through with my imaging reads, it's kind of important for me as I go patient to patient and then case to case as I see them for follow-up. And then when I come out of the room or when I'm done with my dictation, I usually try and prompt Heidi with another 3 or 4 sentences just to like reiterate the most important part so that I know that it's going to pull it in. So, I could say like, yeah, 15-year-old female, she's got patellofemoral syndrome. She's been doing very well with therapy. at this point we can PRN her, or I want to continue her therapy, or she hasn't done well. I'm gonna try and get an MRI scan approved so we can look see if there's anything else we're missing. So that's kind of my basic workflow. And then after that, oh yeah, well go ahead. You can go next slide. So this is kind of how the for you guys that haven't seen this before, this is how Heidi looks on my actual phone when I take it in. So on the far left side, that's just a list of they call them, each patient encounter is called a session. So every single time I go in for a new session, I just click new session. Then it pops up with that middle appearance with the phone microphone. I add the patient details, and some people will use. You can do anything. I mean, if you just want to use MRNs, I just use patient names, and then I just click record, and then Heidi starts working and picks up all the stuff I'm saying out loud. And then once I hit stop on the record, it'll automatically pull up that screen on the right. So it'll have my templates in terms of, and for me, it's just more body part based, but because I see a little of everything. But I just click whichever template, if they're there for a knee, I click the knee. And then after that, it'll close out. It'll go back to the screen on the left side. And then I just go new session, and then we roll on to the next patient. So, all right, go ahead, Will. Next slide. And then once I get a chance, this is so on my actual computer, on my desktop computer at my desk, this is what it'll look like on the actual interface on the through the website itself. So you can see all the sessions kind of on that left side of the screen, again, sort of just by name. And you basically, it pulls this up because this is how I've programmed it, right? And I think that's for me why I like Heidi the most of some of the other AI scribes that I've tried out is just the customization is so good that you can really kind of mold it into what you want it to do, what you want it to say, how you want your notes formatted. So, so it'll come out. This is, and again, chief complaint with the HPIs and the past medical histories and the physical exams, and all of this is formatted like this because this is what my HIP template is telling Heidi to do. So go ahead, next slide. So this is an example of just like my knee template. And this is like I've scrolled down a little bit past like the HPI and the chief complaint and everything, but just to give you an idea, like this is just basically how my knee template is set up for a physical exam. So, once you understand kind of the programming language you need to put in, it's not that hard to try and get Heidi to produce what you're looking for, as long as you can just kind of speak the AI language um, and then it kind of picks up on certain things, right? It'll pick up on something if you kind of tell it. And then as you can see here too, for the imaging section, that's where I want it to just go verbatim what I said on my x-ray read. That's what I want in my note. And again, Heidi does a great job of kind of discerning that and putting it into my note for me. So go ahead, Will. Next slide. And then this is just scrolling down a little bit farther, but there's a lot of different ways to program it. And, as you can see at the bottom of my note here, this is just one way to do it. This is what I've done for knees specifically, because I do something different for shoulders. But, I just have my knee injection down there. And I don't think it captured this in this screenshot, but if you scroll down all the way to the bottom, there's just a parentheses instruction for Heidi and basically says, or actually it did catch it right there at the top. It just basically says procedure note if prompted. So I'll say, hey, I did a ultrasound knee injection aspiration today. I took off 55 cc's, and all that's built into that template. So it'll actually put in, drain 55 cc's, what kind of fluid it looked like, and then it'll tell me, it'll actually even fill in there, put in a steroid injection or put in a HA injection or whatever I did for that encounter. So that's what I do for knees. I do something a little different for shoulders since there's so many different shoulder injections I do. But I found this to be very, very great, very great because it'll pick up the injections when I just prompt it to, and then I don't have to do too much else. So I'll go next slide. So for me, I mean, in short, I guess how's it been helpful? I think for patients, I do think the patients appreciate it a little bit more. I'm not constantly jotting papers. I'm just sitting there. I can actively listen, maintain full eye contact and just be attentive in the room. And I think patients, pick up on that. And then for the practice in general, more accurate notes. We used to with the dictaphones we had scribes on salary, right? So obviously it's going to be just from a financial standpoint, it's going to be beneficial to be able to just, rely on the AI Scribe. It's obviously financially a cheaper option. And for me specifically, quicker completion time on notes is really key. Like I don't have to worry if I have a work comp case or an auto case, or if I needed a stat CT or an MRI, I just come out of the room, and even if I've got 2 or 3 charts on there, I can just take the extra 2 minutes and then say, okay, I'll talk to my MA and say, hey, the note's done. Just make sure when you fax over the stat order that we include the note with it, and then we can get the auth done, even faster. So go ahead. Well, next slide. And then just for myself personally, I just think it's just been so helpful for me to not have to worry, even if I have a really, busy, hectic day. I don't worry as much about taking work home. I know Heidi kind of has everything in there. It's got full HBIs that I can reliably, just kind of proofread and make sure that everything looks okay. The easier note completion at home has been helpful for me. Like I don't, nobody likes taking work home, but it was one thing for me to have to review all these, jotted down notes, try and remember every single piece of that encounter. And I'm sure some of like some of the patients can be a little eccentric, so it's almost like reliving another trauma, having to dictate that whole thing again. But even with some of those kind of like out there encounters I've had, I have found that Heidi does a pretty good job of like weeding through some of that stuff and trying to, medically put in what's relevant for me, which has been great. And it's way easier than having to do that dictaphone work. I can just come home and throw on a football game and just kind of proofread and watch the football game. And it's just it's much more, I guess, like passive or just easier work in terms of me being able to complete all my notes. And then even the other thing too is even if there's an error, let's say I walk out of the room and like I forgot to dictate something, or let's say Heidi for some reason like didn't turn on, maybe I clicked the microphone off. It's still quicker for me to come out and just dictate 20 second to 1 minute dictation of the entire encounter and plug it into my template, and Heidi spits out a note that's still just as good as if the patient conversation happened. So I found that to be really, really helpful as well. So I know some people don't want to take their phones in the room, but I mean, it's almost just as easy to come out and almost treat it like a dictaphone, and you'll get better notes out of it, even if you don't want to take it in the room with you. So, and then basically, I have 3 kids and my wife works. So being able to just spend more time with family over the weekends, I have less stress day to day, more time on the weekends. And that's been big for me because I know like work-life balance is kind of like the new thing for physicians, but especially for me because I have 3 kids, all under the age of 5. So you kind of need that time because yeah, or otherwise my wife would kill me if I was working weekends just doing notes all day. So yeah, overall it's been really great for me. I think super super helpful in terms of like helping with my efficiency. And this is, I'm saying like taking work home, but there's lots of days where like I could still see 35 patients, and especially if I don't have students or residents, obviously if I don't have to do any teaching, I just kind of cruise through the day, see 30 patients, get all my notes done, and go home and be home on time and not have any extra work to do. So, and my notes are clean, my notes are good. My notes are nice and clean. So just when you're seeing high volume, it's all about efficiency. So yeah, I can't speak enough. I think Heidi's been great for that, and all the docs and PAs at the office that also use that have been using it have been having similar experiences just in terms of their efficiency. Just with the volume we see, it's been great. So and then yeah, well, those are the kiddos on the next slide there. So yeah, it's they're a handful in and of themselves. So, but it's always good to have more time for the kids. They grow up fast. So
Awesome. Thank you so much, Matthew. Really appreciate it. Hopefully that was helpful for everybody. If you guys do have questions, the Q&A is open. So feel free to jot those in there, as we go along. Feel free to, delineate who you'd like to answer it. It's probably not me, but if I am the best person to answer it, I'll happily jump in. But without further ado, we have Dr. David Klein, who will also be sharing his experience with Heidi, and I'll let him take it from here.
All right. So Matt, nice to meet you. It sounds like you've had similar experiences. I'm in Sarasota, Florida. We have a 15 physician and 16 PA and nurse practitioner practice, so about 31 of us. We're coming from, like you, an old school kind of EMR that our notes were Microsoft Word based. And there's no integration with anything. So we're using Heidi pasting stuff in, but we're doing that in the old days with human transcriptionists, and now we're just doing the cut and paste thing. So basically, I just found out about this 3 months ago. I didn't even know about the technology until one of my partners was told by one of his friends, and he's like, hey, Dave, why don't you check this out? So Heidi wasn't the first, was actually the fourth artificial intelligence scribe that I tried, but it's been head and shoulders above the rest. So before Heidi, I mean, our workflow was really inefficient. I would handwrite some notes down while I'm talking to the patient, kind of reminder things to myself. Then I'd dictate into a recorder just like you. We'd upload our voice files to a transcriptionist somewhere in the country. They would type them up, charged by the line, send them back to us. This was a slow and expensive process with a significant turnaround time. Sometimes it even led to some negative patient reviews. Some patients liked when I dictated in front of them, and it was always nice when a patient could correct me, or it made me think and I could stop and examine something else or ask another question. But some patients were pissed off. They felt like I was wasting their time. And they let me know in some reviews like that. We tried some other competitors. I won't mention the names here, but their inaccuracies were really a deal breaker. One day I had to salvage a note from a patient whose work-related injury got mixed up with their non-work activities at home, and I didn't notice it as they went out the door. So the next time I saw them, that was a really painful, long note to try to separate out the two. And this is something that I don't want to do again. Basically, as far as cost goes, let's see, where am I on this? You can go to the next slide. As far as cost goes, I said in one of these slides that it was like 6 to 8 times cheaper. When I go back to it, it's actually 13 to 15 times cheaper than the humans. So anyway, the new way, post Heidi, the workflow is fast. I just speak my notes while talking to the patient. Basically, I don't even speak notes necessarily. I'm just talking to the patient. As I'm wrapping up the visit, I just, hand out some paperwork or complete some orders. The notes being created, it takes about 20 to 30 seconds for most of my stuff. And I'm doing it not on my phone, but just on the desktop computer in the room that I also use for viewing x-rays and stuff like that. There's some great pre-visit protocols. Like I just have my nurse go in and put in the patient demographics, so I don't have to type their name in. Some of my partners actually pre-type all their people for the day, and eventually we'll also move to something like Athena that we'll be able to link, but currently we can't. This lets me multitask and get notes done even before the patient leaves the room. One of my partners, he was just astounded. He said that on his first Heidi day, as his last patient left the exam room, he was able to leave the office at the same time. He said that this was the first day ever for him in practice that was like that. So he was thrilled with that. All right, next slide, Will. Let's see, I guess I'm actually on the prior slide, but anyway, getting used to speaking my notes out loud was kind of a learning curve for me. Like my physical exam and stuff like that. And there's a lot of stuff that I think that, Matt, maybe you're the same, but just like you'd see stuff and you'd make a mental note of it, but the patient didn't know you were making a mental note of it, so they didn't give you credit for it. But, you're seeing all the stuff. So now I just have to talk. And at first I was talking awkwardly, but then I realized I could just say things just like for the patient to understand, like, hey, yeah, you're right. You're really very weak on your dominant right side, while I'm performing the examination. And then when I look at the images, I would often just read out the radiologist report, but then I just pop the images up on the screen and show the patient and say, here, look, we're looking at 4 views of your right shoulder, and I can see you've got some moderate arthritic changes, but no high riding humeral head. A lot of the patients then are like, I don't know what you just said, but basically that captures everything. And then especially if it's an outside MRI or something like that, my template for Heidi says that if I'm looking at the images, then Heidi throws in a specific phrase that's important for billing that says, you know, I separately viewed and interpreted the images. And I don't have to say that. It just goes in triggered by me saying, when I look at images. So there's a few things that I think are like rules you got to follow. For example, you can talk about football games or going to movies or what you like to eat or what the patient likes to eat. But if you're talking about anything medical, it's really important just to discuss the patient's medical history, because otherwise sometimes, like I had a case manager talk about her own illness and that got recorded as part of the patient. That wasn't so good. The other thing is you have to identify who's in the room. So if I have a Creole Haitian speaking patient with a translator, then I just say, like Jacques is here as a professional translator. And then that goes into the note also. I also have my templates put patient quotes both in their native language and in English. Let's see. Stay on this slide. So Heidi is really customizable, as Matt said. I've set up my templates to automatically format my physical exam notes with some tables. And then for workers' comp, if I say anything about workers' comp, then it triggers some language in Florida that you need to say for workers' comp. I've also created some different templates like Matt has for common injections. But also, if I just do something that's not a common injection, I just kind of say it out loud. If I say 6 milligrams of Celestone and 1 cc of lidocaine were injected into the patient's right piezotriquetral joint, that's what Heidi puts down, and it's great. Also, our x-ray techs like to know what x-rays are needed on the next visit. So I literally have an arrow that shows up at the bottom. It's just 2 equal signs and a greater than sign. And then it says what x-rays need. At first, I was dictating all that, and then I realized I could put in the template things that I need x-rays for, like follow-up fracture patients, they need x-rays. Rotator cuff issues, they don't need x-rays. And I've been refining that over the last few days, and now I find Heidi's really good at picking who needs x-rays and who doesn't need x-rays for the next visit. Also, with, let's see, just go to the next slide. There's a feature at the bottom called Ask Heidi. It's kind of where you can put a prompt in for whatever you're doing. And that's really a game changer because I can generate documents that would have taken me extra time to do stuff. Like, for example, I've got some basic templated physical exam things. But for example, I had a spinal cord patient who I did a bunch of tendon transfers for. So the occupational therapist actually came with the patient and was in the room. So I talked with her on what all the goals were and how to manage the different transfers and what to look for as far as pushing with passive or active motion and stuff. And then basically, since that didn't fit any of my therapy templates, I just typed into Heidi, write an occupational therapy prescription to match what we talked about. And while Heidi was generating the note, I typed that in. She's doing the office note. I typed that underneath. And then she starts typing out a therapy note, therapy prescription that I sent out with the patient. So that was great. Also, patients' advocacy stuff, like they say, can you write a note so I can get my gym membership back and stuff like that? Just ask Heidi to do that. It's much quicker than doing it yourself. Furthermore, I kind of like the idea that since our EMR has no mobile access, I can get mobile access for the patients I've seen via the Heidi app on my phone, wherever I am. So I can read notes if a doctor calls me, if an ER calls me, if the patient's call on call or stuff like that. So I can't even do that with my current EHR. And then, of course, at the end of the visit, all I do is a simple cut and paste or copy paste from Heidi into our EHR. So next slide. So now 11 of our 31 have adopted Heidi fully. Another 16 have started, so we're well on our way to losing our human transcriptionists completely. And it's interesting to see different approaches. Like Matt mentioned that he uses ambient transcription most of the time, in other words, just while he's talking. But if he's caught and forgets to push record or something, he can just quickly do an old style dictation and Heidi figures it out. So one of my partners prefers to do that. Actually, he doesn't even do dictations till like lunchtime, and he'll take a whole stack of charts and just talking to a microphone as if he's talking to a human transcriptionist, including things like, oh yeah, go back to the physical examination. I forgot to add that, O'Brien's sign is negative on the right and positive on the left. And Heidi gets all that and dishes out notes that look like any other notes. I mean, any other good notes that would be done like with my ambient transcription. So you can use different rhythms and different styles to make it work. Furthermore, as Will is there to help out, lots of people like Will are there for help. There's different ways to get help with Heidi from, online stuff plus humans and stuff like that. And it's been really easy since I'm only 3 months into this learning curve. Another thing I've gone through teaching Heidi with a find replace, how to spell like all the local doctor names from all the phonetic ways that Heidi would come up with, as well as urgent care centers, imaging centers, laboratories, stuff like that. So now, when the patient says, oh yeah, I went to Parkway Urgent Care, it comes up correctly as Parkway Urgent Care, and stuff like that. So that's really nice. Plus, I even have at the bottom, we send notes out to other doctors via just unfortunately old school, like we have humans taking the notes and either faxing them or mailing them. So I have Heidi listen for the doctor names, where we actually save the doctor names per patient at the beginning when my nurse types them in. So the bottom of each note is like CC primary care doctor name. And if the patient's, seeing rheumatology, it'll also say CC the rheumatologist. So anyway, in summary, I would say that Heidi brings like accuracy and completeness to medical record creation, but with speed and economy. Furthermore, what sets it apart, as Matt mentioned, is really the customization of templates. And I also can, show some of that because it's been fantastic. For another little tip that I just figured out myself a week or two ago is just to tell Heidi to make what I call an orienting statement. First part of the history of present illness, even on a follow-up patient, I want to be an orienting statement. So when I read that, I can remember who that person is, like, 46-year-old landscape architect from Sweden who's had a 3-month history of numbness in her right hand. And I'm like, oh yeah, now I remember that woman, and I can walk into the room without like trying to say, who is this person? Which was always a problem with lots of other ways to do notes.
David, you maybe want to take a pause here, and then you can share your screen and walk through some of those different use cases in the application.
Okay.
Cool. Awesome. Let's take a pause. In this moment, I know we did have a question. So I guess, David, while you get that set up, and let me know when you're ready. You should be able to use the share button. But
yeah, I guess it says somebody else is sharing, so I can't do it.
Yeah, it's a good call. Try that. So Michael had a question about shoulder injections, and he asked this at the end of Matt's presentation. So I'll let you take it away, Dr. Z. He says, how do you deal with shoulder injections? Is there a way to insert a template on the fly? Like, hey, Heidi, insert right shoulder AC joint injection. So yeah, how do you handle that?
So right now with how my template is set up, I use, and all of my injections are already into the, like in our like I have templates in our actual EMR. So lots of times what I'll end up doing is just copying and pasting my injection note and putting it at the bottom and then inserting the whole Heidi note afterwards. However, I have experimented with this, and I think it's equally as quick. You can do that tag. There is tags, they call them snippets with Heidi. So you can preload all of your injection notes. So your bicep sheath, glenohumeral, subacromial, AC joint. You can have all of those inserted, and it's just like almost, if you're familiar with dot phrases, or it's basically just a slash tag. So you just click slash, and I type in like GL, and then it'll pull up glenohumeral. I just hit enter, and then it'll come in there like that. So and you can put that directly into the end of the Heidi note. So I think there's a lot of different ways you can do it. I have not, because I was talking to Will about this too. You could try.
See the screen yet?
Not yet, David. No, sorry.
I was gonna say, you could try, like I have with my knee injection, you could reasonably try and insert all of the shoulder injections you do into a template. I don't know how Heidi would sort that out, but but I've had success with everything else, so I don't see it like, especially if you do the same like three more common ones, you might just be able to insert all three of those and just be like, okay, I did a glenohumeral injection today. So insert that templated note. So I think all those are like reasonable ways.
It looks like David's got just exactly what you're discussing right in front of us here.
Yep.
Yeah, so this is what one of my partners came up with, and so I just copied it from his template. But he put he's also an upper extremity guy, so he put all the all the places he generally gets shots: subacromial space, intra-articular, shoulder, subacromial and intra-articular, bicipital groove, and he just went through all these, and basically they're all like if-thens. And basically, so if Heidi just hears, yeah, I gave, a subacromial shot, she puts in the appropriate stuff. And then also repeat as needed for additional body parts or additional procedures. Mention if available, otherwise omit completely, meaning none of this shows up if you didn't give a shot. And then, some standard stuff like, risks, benefits, and alternatives were discussed and stuff like that. So that's how we do it. And I even found like Heidi was making not templates, but did procedures for needle aponeurotomies for me, just for me saying that I'm doing a needle aponeurotomy and describing what I'm doing to the patient. So a lot of it just kind of comes by itself.
Beautiful. Love it. Thank you, David. So that's perfect. Any more questions you guys got, just throw them in the Q&A. But yeah, David just had a couple kind of mock or fake sessions. He was going to show us the way that he does his notes. So without further ado, let him take back over.
Yeah, let me move this out of the way. So I have actually very few templates. Basically, my templates I'll show here with some, let's see, we'll go created by me. So my main templates are basically a new patient and a follow-up patient template. And then, there's a few other things like a work comp case manager conference. And it's nice because Heidi can do multiple notes at one time. So while it's kind of chugging on making your office note, if you have a work comp case manager, my work comp case manager note, basically I've just said that I want a short paragraph, less than 200 words, stating that I discussed that with the patient's case manager, the reasons for the care and decisions, as well as future pending care decisions, with all information taken from the transcript. The transcript is what Heidi hears. Contextual notes, which is a place you can type stuff in or paste stuff in or import stuff, or clinical information if available. And I say that if no information is available to summarize from, then just print a short case care conference was conducted with the patient's case manager regarding their continued care. So basically, this gets you, you have to document if you get additional pay to speak to a work case manager conference, whatever, this covers you for that. So that's that template. I have another one for IMEs, which I've only done one of in the past 3 months. But for this one, in addition to, by the way, we have a standard like paper chart for review of systems stuff. So I can say, the patient said XYZ for shortness of breath or something like that. So this pops in positives for positives and negatives for everything else. But in the IME one, in addition to all the exam and imaging studies and just general assessment, I put an additional notes for questions posed on the injury and current condition, because if it's an attorney or a judge or something like that, then that gets addressed separately at the end. And by the way, Heidi was just awesome when I did this and had some huge notebook full of a zillion records to go through. I just flipped through them and let's see, I can show you a redacted version of that, because that was the easiest IME thing prep I had ever done. Let's see, let's bring up that session. So I have to keep moving my thing around the screen here. Okay, so chief complaint, history of present illness is a fake name and some fake history stuff in here. But when you get down to the part where I've reviewed the prior things, I just told Heidi I want everything summarized by location and by date. So there's a hospital, there's a doctor, there's a clinic, there's another doctor, and it's all by date, and it's all chronologic by date. So you can quickly go through and see it, which is awesome. And then this is an example of Heidi just making a template. So you tell Heidi that you want stuff in tables with markdown protocol, and they're not lined up perfect. I haven't figured out how to get that yet, but it's so much easier to just read this than read a paragraph. Unfortunately, for finger contractures, I got a paragraph, but for other stuff, I get tables, which it's a work in progress, and it's getting much better. And then I get down to the end, and these are the answers I gave for the questions from the judge, and they go in there. I even made a template for Heidi for office meetings and stuff like that, and then I just used it myself. I like computer flight simulators, so I went to Providence to Flight Sim Expo this year, and then after that, I had a whole bunch of like people's cards and numbers and stuff like that. So I just went through them in the evening and just talked to Heidi. And basically, Heidi came up with this template with or not template, but document with all these different people I had spoken to about what I had spoken to it, and had their names and emails, and then had little sections on, what to do after the fact and stuff like that, because it's an office meeting template, but it works for anything. But yeah, this has been just, amazing, for ease of stuff, for ease of understanding stuff, for ease of just documenting and looking at stuff. Recently I told Heidi to split out some inspection, palpation, and functional testing as part of the physical examination. Additional treatments and procedures. So that's generally injections, but Heidi recognized that for this patient with swan necks, I adjusted her silver ring splints. So she put that there in a separate note. And then there's like an additional note section. So we have stuff like that. But yeah, I don't know if anybody else has any questions, but this is basically, what I've been doing with Heidi to have it create stuff for me.
Yeah.
X-rays for next visit, right hand PA lateral and oblique views.
Yeah, beautiful. Awesome. No, David, thank you so much. Yeah, any questions, guys, please throw them in the Q&A. I know there's a lot going on here. Hopefully you guys are all fairly familiar with Heidi overall, because we're obviously talking about, I'd say, some more kind of in-depth concepts here. If you guys aren't familiar with Heidi already, we do live onboarding several times a week. There was one actually at 6 p.m. tonight, and I can link that if you guys would like that in the chat. But otherwise, David, I'll take the screen share back over for the moment.
Okay.
We may wrap up a few minutes early here. I doubt anyone will be upset about that. But yeah, so I just wanted to touch on some of the upcoming improvements and features that we're launching. EHR integrations is obviously top of mind for a lot of folks. As Matthew alluded to, we do have an Athena integration. It's great, but the V2 one's coming out that's going to be even better. It's going to have Smart on Fire launch, so directly embedded in Athena. We're about to launch our ECW integration, eClinicalWorks via Vim, which is kind of like a third-party marketplace that does integrations. We have a Veradigm integration that's online right now and getting a little bit more robust in the coming months. From a workflow enhancement perspective, we talked a little bit about snippets here. Another way to handle injections that we've seen is actually, using the snippets, but actually in the context tab. So that way Heidi will kind of take that direct information and then include it where it needs to go based on the template. It's one way that a clinic that uses Heidi, St. Cloud Orthopedics, chooses to do their injections. But as kind of Matthew and David mentioned, it's a very flexible platform, and ultimately you guys get to decide, the best way to handle it. We also added live transcription, so you can actually, launch Heidi as transcription next to the note, so you can see as it's transcribing. Some people like that, just because a little bit more feedback. We are launching some other mobile improvements to make it, increase the kind of feedback you get throughout the transcription process, making sure everything's going well. We're also launching a new template management system that should come out, and management and editing system should come out in the coming weeks that allow you to kind of chat with Heidi to edit your templates a little bit more easily. And a couple other features. we recently launched that are relevant for a lot of clinics. The task generation. Heidi is automatically identifying tasks based on the visit. We've made some improvements recently to our ICD coding model. So Heidi suggests ICD-10 codes based on the visit. And then we also recently added multi-language transcription, I should say, not dictation. But multilingual consults are now, supported on Heidi. So just some things that we saw that were fairly relevant for orthopedics, but love to hear if you guys have any questions. Oh, Practice Fusion, Sloan. That's a good question. I think they are on our list of folks that we're trying to work with. I have to double check. If you want to see a definitive list of who we integrate with, I can kind of pull that up right now. Is Practice Fusion made by somebody else? I'm trying to recall exactly. Let me stop my screen share here. I've heard their name before. Let's see. And so within the app, there is a place where you can see all kind of our integrations marketplace. I'll briefly just share my screen. So under settings, we have our EMR integrations tab. Yeah, we have Practice Q. That's what I was thinking. No, we don't have integration with Practice Fusion right now. That being said, I think Practice Fusion you access via the browser. If I'm right on that, we do have a Chrome extension that you can access via the browser and essentially run Heidi in the same window as your EMR. So there's information on that in the Help Center. I can send you information if you like on how to use that. Hey, Michael. Okay, so as far as onboarding sessions, we do them, last I checked, 4 or maybe 5 times a week at this point now. It's if you go to heidihealth.com/live-onboarding, you'll find that, and it's each RSVP. It's a webinar like this, but kind of starts with the basics and builds from there. And yep, that would be the live onboarding sessions. I'll show you guys here. You guys can still see my screen, I hope. So you can join a live onboarding session. You just RSVP, and it looks like we got one tomorrow at noon, Friday 8 a.m., Friday at 11 a.m. Eastern, so 8 a.m. Pacific, then Tuesday, Wednesday, Thursday. So a lot of them coming up, a lot of opportunities to learn from folks on our team. Beautiful. All right, guys. Well, thank you all for joining us. It's really been a pleasure. Hopefully you learned something here. Dr. Klein, Dr. Zaborowicz, really appreciate you guys sharing your time. If you guys have any questions, feel free to follow up with me directly. My email is william@heidihealth.com. I'll be reaching out to all of you guys with, just an introduction. Would love to work with you guys to help you get templates set up. And yeah, it's really been a pleasure. Thank you guys so much.
Right.